My name is Kelsey Gheen. I've been a registered nurse for 5 years. I've been with Genesis all those 5 years. I've been a certified diabetes educator for a year now. I've actually been in the diabetes education department for 3 years. Diabetes has many signs and symptoms. The main ones are increased thirst, increased urination, blurry vision, infections that you can't get to heal very well, feeling really tired and really sluggish and wore out. It also can make you feel like you're hungry all the time. You could eat a huge meal and then right after that, you actually still feel like you're hungry. So there are lots of symptoms to that. Some people don't have any symptoms, which is kind of alarming. So that's why it's very important to know risk factors of developing type 2 diabetes or prediabetes and getting tested appropriately by your provider. So if you have symptoms of diabetes, including the increased thirst, increased urination, we definitely recommend going to see your provider as soon as possible. Either calling them. If you do not have a primary care provider, we do recommend going to a first care or an emergency department. Just because diabetes is a very serious condition, we definitely want to get it treated as soon as possible. If you have those symptoms, call your provider, get in, be seen. Also learn the risk factors because you also may not have symptoms of type 2 diabetes. So risk factors include severe family history like genetics. If you have parents, grandparents, aunts, uncles, that increases your risk for developing type 2 diabetes. Age over 45, obesity, and inactive lifestyle are the main risk factors. So if you have those symptoms or the risk factors, we recommend being tested at least once a year just to make sure you're not developing type 2 diabetes. So learning about diabetes, especially in our region or in Zanesville, is important. Learning about diabetes all around is extremely important because, if you don't know, you can't treat it and you can't do anything to help kind of prevent the long-term complications. But in our 6 counties that Genesis covers, there's actually a 13.6% of our population that have been diagnosed with type 2 diabetes. That's a huge number. Our risk for developing diabetes is greater here because of the diet and the atmosphere and the lack of healthy food options, and there's a lot of poverty here in those counties and surrounding areas, so that increases risk for developing type 2 diabetes as well. In Ohio alone, there's actually 37% of the population that have diabetes and aren't actually aware that they have it. So it's very important to learn the risk factors and get tested if you do have those risk factors. So there's actually a lot of treatment options for diabetes, no matter what the type. The biggest treatment option for any type of diabetes, including type 1, type 2, prediabetes, is a good diet and exercise. Diet can really help control the sugars by what you're putting in your mouth. You can physically control that yourself. I see people all the time that are first diagnosed with type 2 diabetes and they just change up some diet and add some exercise, and it actually can really bring down their A1C and their blood sugars just by doing those 2 steps. Exercise is a really great form of your entire health, especially diabetes, because it actually helps you get rid of the sugar, and it also helps your insulin go to where it's supposed to go to help get your blood sugars to come down. So your hemoglobin A1C is a number that's drawn through a lab. It's a lab draw, and they actually run it, and it's able to show the last 3 months of what your blood sugars have been running. So that's why the doctors want to do it at least every 3 months. Sometimes they'll do it every 6 months. But what it's actually looking at is how much sugar is coating your red blood cells. We don't want hardly any sugar coating our red blood cells. Sugar is actually our fuel to go about our day. It's our energy source, and we want it inside of the red blood cells. When it's on the outside of the red blood cells, it just means that our pancreas and our insulin is not working the way that it's supposed to. The pancreas produces insulin. The insulin brings down our blood sugars. So with diabetes, you actually aren't producing enough insulin to bring your blood sugars down. So when that happens, the sugar kind of accumulates on the outside of the red blood cell, and this can cause the long-term complications. The red blood cells actually only live for about 3 months, and then they die off and your body creates more. So that test is actually looking to see how much sugar is coating that entire cell during its entire lifespan. So So it's an average of what your blood sugars have been running over the last 3 months. So you could have numbers high and numbers low, and it kind of gets something right in the middle of those two high and low numbers. So it's a very important test to have done. It gives us a good baseline of kind of where you're starting out at. We can set a goal of where we want you to be. The American Diabetes Association recommends getting your A1C to 7% or less if you already have diabetes. A normal A1C is an A1C of less than 5.7. The most common complications that can happen with somebody that has uncontrolled diabetes are heart disease, strokes. It can cause kidney failure. It can cause eye disease known as retinopathy, and it can also cause neuropathy, which is numbness, tingling, or burning sensation in your hands or feet. But having a good understanding of diabetes and really trying your best to control it and having good communication with your provider, it is very possible to prevent these complications from happening. With technology and diabetes, there's just been massive movements in the last couple years. Even in the last 3 years that I have been a diabetes educator, there has been so many improvements and new inventions that have been coming out to help better control the diabetes. I'm very excited for them because it makes life with diabetes a lot easier for people that can get them. The biggest one that we see right now is called a continuous glucose monitor, or a CGM for short. This is a monitor that the patient wears for 7 to 14 days, depending on the brand, and it tracks their blood sugars automatically every 5 minutes, and it goes to a handheld device where the patient could look at this whenever they wanted to see what their blood sugars are doing. This is a phenomenal tool to really help get their A1C and their blood sugars under better control. These are usually covered by insurance. There are some barriers to that. So it just depends on your insurance company, on what type of diabetes you have, and also your treatment options for managing diabetes currently. If you ever have any questions, or you want to get something like this, I really encourage you to talk with your provider about them, because they are really great tools in helping manage diabetes. So another type of diabetes is something called gestational diabetes. This is diabetes during pregnancy. A lot of times when a person becomes pregnant, their body is going crazy with hormones. Insulin is actually a hormone that's produced by the body, and a lot of times with pregnancy, that hormone is the insulin. It's not being produced enough. So the mother's blood sugars go high. It can cause severe effects to the baby if left untreated. In our Department of Diabetes Education, we do offer gestational diabetes trainings. You'll meet one-on-one with a registered nurse and also one-on-one with a dietitian to really help get you through that process of making sure that you and your baby are safe at delivery.